The heart is one of the most important organs in the human body, functioning like a durable pump that transports oxygen-rich blood and nutrients to every cell. When we are young, the heart usually works strongly and flexibly, rarely encountering problems. However, after passing the age of 45, aging gradually appears, bringing silent changes in the structure and function of the heart. Especially a modern sedentary lifestyle, diets high in fats, salt, and sugar, along with genetic factors or underlying conditions such as hypertension, diabetes, and lipid disorders, increase the risk of cardiovascular diseases. The concerning thing is that most heart diseases progress silently over many years. It is only when serious complications such as heart attacks, strokes, or heart failure occur that patients truly realize the severity. However, from early on, the heart sends subtle warning signals. If we know how to listen, we can completely detect, control, and effectively prevent the disease. Below are the early warning signs of heart disease that anyone over 45 should not ignore. First, chest pain or tightness is the most typical and common symptom of heart disease. Many people describe this sensation as a squeezing, heavy, crushing or pressing pain in the middle of the chest. Sometimes the pain radiates to the shoulder, neck, lower jaw, back or left arm. In elderly people, the symptoms may be unclear, presenting only as a burning sensation, fullness, or mild discomfort. Especially if the pain occurs during exertion, climbing stairs, carrying heavy objects, walking fast, etc., and subsides with rest, it is a typical sign of ischemic heart disease, a very dangerous form of coronary artery disease. However, not everyone feels the pain clearly. Therefore, never be complacent with any unusual sensation in the chest, especially if you have risk factors such as high blood pressure, high blood lipids, or a family history of cardiovascular disease. If the pain lasts more than a few minutes, recurs, or is accompanied by other symptoms such as shortness of breath or sweating, see a cardiology specialist as soon as possible. Shortness of breath and breathlessness are warning symptoms that should not be taken lightly. Many people, especially the elderly, often think that shortness of breath is due to age or lack of exercise, without realizing that it could be a sign of heart failure or other cardiovascular diseases. When the heart is unable to pump blood effectively, fluid accumulates in the lungs, causing a feeling of suffocation, especially when lying down or exerting oneself. Some cases require propping up with high pillows to sleep or sitting up in the middle of the night due to difficulty breathing. This is a very typical sign of heart failure. Do not hesitate if you notice yourself becoming breathless when walking lightly, climbing stairs, or doing daily tasks that previously did not tire you. Another often overlooked sign is prolonged fatigue without a clear cause, which does not improve despite rest and adequate sleep. When the heart pumps blood weakly, the organs in the body do not receive enough oxygen and nutrients, making you feel sluggish, lacking energy, and quickly exhausted by any activity. Especially if you were previously healthy and active, but suddenly frequently feel tired, consider the possibility of cardiovascular problems. A feeling of rapid heartbeat, palpitations, arrhythmia, or even abnormal fluttering in the chest is also an important sign of arrhythmia. Sometimes, the symptoms are accompanied by dizziness, lightheadedness, or even fainting. In people over 45 years old, arrhythmia, especially atrial fibrillation, is the leading cause of stroke due to blood clot formation. Do not hesitate to get an electrocardiogram, ECG, if you often feel an irregular heartbeat. Early detection will help prevent many dangerous complications. Another easily noticeable symptom is swelling of the feet and ankles, especially in the afternoon or after standing for a long time. When the heart is not strong enough to pump blood back, blood will pool in the lower limbs, causing swelling. This condition may be accompanied by a feeling of heaviness in the legs or even mild pain. Foot swelling can also be caused by other reasons such as liver or kidney disease. But if it persists or worsens, consider the possibility of heart failure and see a doctor for a comprehensive examination. A persistent cough, especially at night, without phlegm and without signs of respiratory infection, is also a warning sign of left heart failure. When heart function declines, fluid can leak into the lungs, causing irritation and leading to prolonged dry coughs that are hard to stop. Many people mistakenly think this is a symptom of chronic lung disease, without realizing that the heart is the hidden culprit. In addition, sudden fainting or dizziness when changing posture or exerting effort is a serious signal that requires special attention. After the age of 45, fainting may be caused by low blood pressure, cardiac conduction disorders, heart valve stenosis, or other cardiovascular diseases. Never take fainting lightly, especially when accompanied by chest pain, shortness of breath, or a history of cardiovascular disease, as this may be a warning sign of sudden death. Some people may not feel chest pain, but instead experience a dull ache or soreness in the left arm, lower jaw, neck, or back. This symptom is common in women or the elderly and can easily be mistaken for musculoskeletal pain, stress, or minor injury. However, if the pain spreads, accompanied by a feeling of chest heaviness, difficulty breathing, or occurs during exertion, consider the possibility of heart disease. Another symptom to note is wounds that heal slowly, discoloration of the skin on the hands and feet, coldness or numbness. These are consequences of poor blood circulation due to a weak heart pump. When blood circulation is inadequate, distant tissues, such as the hands and feet, receive less oxygen, causing the skin to become pale, cold, and sometimes develop ulcers that heal slowly or deform fingernails and toenails. If you notice these changes, have your cardiovascular system checked as soon as possible. Not only that, mood and behavioral changes such as prolonged anxiety, depression, insomnia, or memory loss can also be related to heart disease. The brain is a very sensitive organ to the lack of oxygen and nutrients. When the heart pumps blood poorly, neurological functions are affected, leading to emotional and cognitive disorders that many people easily mistake for old age diseases or stress. If you're over 45 years old and suddenly experience unexplained mental disorders, don't forget to check your cardiovascular health. In particular, people at high risk of heart disease should proactively undergo regular health checkups, even if no symptoms have appeared. These include men over 45 years old, women over 50 years old, individuals with a history of hypertension, diabetes, high blood cholesterol, smoking, physical inactivity, obesity, or those with relatives who developed cardiovascular disease early. For this group, early detection of warning signs is life-saving and helps prevent severe complications later on. So, what should we do when we notice signs suspicious of heart disease? First of all, absolutely do not self-treat or ignore the symptoms. Specifically recording the time of onset, severity, frequency, and related factors of the symptoms will help doctors make a more accurate diagnosis. Proactively see a cardiology specialist as soon as possible to get advice and undergo necessary tests, such as electrocardiogram, echocardiogram, blood tests, chest x-ray, blood pressure measurement to help detect damage early and have an appropriate treatment plan. In addition, lifestyle changes are equally important. A healthy diet that minimizes salt, animal fats, and processed foods, while increasing green vegetables, fresh fruits, fish, and whole grains, will help protect blood vessels and the heart. Gentle, regular exercise such as walking, cycling, yoga, and swimming not only enhances cardiovascular health, but also helps control weight, reduce stress, and prevent many other diseases. Maintain an optimistic mindset. Get enough sleep and avoid prolonged stress as ways to protect the heart from the negative impacts of the modern living environment. If possible, quit smoking, limit alcohol consumption, and keep blood pressure, blood sugar, and blood lipids within acceptable levels. Finally, remember that the cardiovascular system is the main engine of the body, determining the quality and lifespan of each of us. After the age of 45, proactively listening to your body and recognizing early warning signs of heart disease is essential to protect your health and enjoy a full, meaningful life. Never be complacent with even the smallest signals. They could be a valuable warning from your heart. If you have any doubts, see a doctor, because cardiovascular health cannot wait. And you absolutely deserve to live healthy and happy every day.